Today is 21st October 2019, day 3 after the eye enucleation surgery. This is the 11 years old male neuter Shih Tzu. Last 11 months ago, he came here for the first concert with the problem of left eye, cloudiness, and ulcer and scarring on the cornea.
Okay, so that was 11 months ago, but before that, the dog already had this eye problem, the left side. Yeah? Now, of course, we are showing the left eye which had been removed, or the eyeball has been removed, so you don't really see the left eye. Now, look at the right eye. You see the right eye is quite normal. There's no tearing, no ulcers, in the sense that you can see the cornea is clear, not cloudy. See, very normal. Now we had another video which will show that the cornea is whitish and also dry with some yellow pus on the surface, and the eye white, the sclera, show the sclera of the other eye was very much redder. But this is a video on the surgery, the eyeball removal, and we will talk about the history. So it was 11 months ago.
Yeah.
First
11
consultation.
months ago, first consultation, we did under the gas anesthesia, we did the eye flashings and then fluorescent eye test. Fluorescent eye test show positive.
Positive, showing that there is corneal ulcer. The cornea will be stained green. Okay, so the one was diagnosis would be corneal ulcerations, and that was 11 months ago.
After
Okay.
that, a month later, 10 months ago,
10 months ago.
he came for the second consultations with the complaints of tear in left eye and the eyeball is prolapsed.
Prolapse, the eyeball pop out a bit more than normal.
The cornea is white, about 90% of the eyes.
That means there's some inflammation,
Night
keratitis.
Night blindness occur occasionally, left eye, and retina also have hemorrhage and but no eye rubbing.
Okay.
We did the fluorescent eye test again, but this time showed negative.
So there's no eye ulcer because it's already scarring and healed up. Okay, that was 10 months ago. Then after that?
After the for the third concert,
The concert 1 month ago.
A month ago, he came for the third concert. Same problem, left eye discharge and cloudiness.
That was the left eye, yeah.
Yeah. We do the eye flashings and do the fluorescent eye test, show negative.
Okay, then after that,
After that-
fourth consultation.
Fourth consultation, last 4 days ago, he came for the fourth consultation with the same problem, left eye discharge and then cloudiness of the eyes.
And dry eye. So
Dry eyes.
I recommended the eyeball to be removed because the dog has been rubbing the eyes on the wall, and it was really bad. But now we are showing what happened is the eyeball had been removed 3 days ago, and the dog must have rubbed the eyes because I noticed that this part is bruised. Normally these are the signs of the dog rubbing, and otherwise you shouldn't be bruised. So it's most likely he's already still feeling itchy and painful. Now the e-collar must have been not sufficient because the dog is known to rub against the wall even when they wear e-collar. So
We
now
also can rub with the e-collar.
now they have given a fentanyl patch, and hopefully that the dog does not feel so painful now. Now this about 14 days later, you will find that the dog has fully recovered. The two eyelids have been stitched up using the horizontal mattress, which we can't see clearly because of the bleeding, the bruising. But below you can see two or three
3 stitches.
three horizontal mattress stitches, which you can't see clearly, and then there's a gap there for the drainage. Show the gap. Normally you have to leave a gap. Okay, so this concludes the case study of this dog. Now, enucleation or eyeball removal, in my opinion, is the best solution for a dog that has very painful and itchy left eye, because the dog keeps on rubbing against the wall. That's what the owner complains, rubbing, even though there's an e-collar on 24 hours a day, and that's why the owner came three or four times to try to solve the problem, but the eyeball got worse. In fact, there was a slight prolapse of the left eyeball, and more injury to the cornea as compared to the right eye. Right eye, you see there's no injury. Open up, it's very clear. No, I'm open the eyeball. The cornea is very clear. There's no tearing. You can see it's very. There is a normal tears, and the dog doesn't bother about it. No? Okay. So in conclusion, that some vets may not like the idea of removing the eyeball, but in some cases, it's up to the judgment of the vet and the owner. In this case, the owner consented to it, and I would expect this dog, 14 days later, the bruises should be gone, and the two upper and lower eyelids, which had been cut, will heal nicely, and the dog will live a normal life without pain in the eye, in the left eye, pain and itchiness. Even though you see, even with this enucleation, the bruises actually, from what I see, was actually also part of it was due to before surgery, this part was already inflamed. If you look at the old, images now, you will see that too. I shall stop now. So enucleation is a solution in some cases of painful and itchy dry eyes.